What is a breast biopsy? A breast biopsy is a diagnostic procedure to remove a small sample of breast tissue for laboratory testing. Doctors use this sample to identify and diagnose abnormalities and evaluate whether breast cancer is present. However, most breast biopsies are benign. The lab report from the breast biopsy can help determine whether additional surgery or other treatment is needed. Your doctor may recommend a breast biopsy for a variety of reasons. For example, if a lump or mass can be felt in the breast, or if a mammogram, ultrasound scan, or MRI reveals a suspicious finding, if there are unusual changes in the nipple, or if there is a thickening in the breast, or the doctor suspects breast cancer. There are several types of breast biopsy procedures. Your doctor may recommend a particular procedure based on the size, location, and other characteristics of the breast abnormality. A fine needle aspiration biopsy is a quick procedure used to evaluate a breast lump found during an exam. A doctor will insert a very thin needle to remove fluid from a cyst, which can then be sent for lab testing. A core needle biopsy may be used to assess a breast lump found on a mammogram, ultrasound, or during a clinical breast exam. A radiologist or surgeon uses a hollow needle to remove tissue samples from the breast mass using ultrasound guidance. A stereotactic biopsy uses mammograms to pinpoint the location of suspicious areas within the breast. A radiologist or surgeon uses a hollow needle to remove tissue samples from the breast mass using mammogram guidance. A surgical biopsy may be used to remove all of or part of a lump for evaluation. An excisional biopsy removes the entire tumor or abnormal area. Most patients will go home immediately after a biopsy and are able to resume normal activities within a day. Bruising is common after core needle biopsy procedures. Patients may take a non-aspirin pain reliever and apply a cold pack as needed to reduce swelling or ease any discomfort. Patients who undergo a surgical biopsy will likely have stitches. After the biopsy procedure, breast tissue is sent to a lab where a pathologist examines the sample and creates a pathology report that they send to the referring doctor. The pathology report includes details about the size and consistency of the tissue samples, the location of the biopsy site, and whether cancer, non-cancerous changes, or precancerous cells were present. Occasionally, patients may need surgery to obtain more tissue to further evaluate the area. If the pathology report determines that breast cancer is present, it will include information about the cancer itself. Doctors will then work with patients to develop a treatment plan that best suits their needs. It's important to understand that breast abnormalities are more likely to be benign. However, even if cancer is detected, it's often found at an early stage when it's easier to treat. Routine screenings and exams are an important way to take control of your health.